Thank you. Good afternoon. I had a moment with Mike Bloomberg a few minutes ago, and I asked him about some of his experience and to give me some tips as new Director General, because his experience as mayor of Big Apple and also his experience in his own companies, I believe is relevant for any organization. And I was not surprised, but I was so happy to hear to what he had to say and things that really made sense to me. So thank you so much. And I preferred actually to start with this. And this was pro bono. Although, shall I tell them? Then we agreed finally to pay $1 a year for his advice. That's what his words. Yeah, thank you very much again, Mike, for hosting this event and for your leadership. And thank you also, Minister Basso of Uruguay, and everyone here, colleagues, friends, excellencies. And everyone here for your tireless work to stop people dying in the prime of their lives from illnesses like cancer and heart and lung diseases. We're meeting at an important moment. Health is at a political tipping point. 10 days ago, I attended the G20 meeting in Hamburg, Germany. That was the first time that WHO attended, and I would like to use this opportunity actually to thank Chancellor Merkel and her government for this. And last week also leaders met in London to recommit their efforts to ensure that women and girls around the world have the services they need to survive and thrive. And this week, top government officials from around the world are in New York to review progress toward these 5 key SDGs, including the health goal. For WHO, the center of gravity for the SDGs is universal health coverage, as you know. And the mantra of the SDGs is leave no one behind. And that's why I say SDGs is the opportunity. And that's exactly also what universal health coverage is and does. That's leave no one behind and using the SDG as an opportunity. And UHC also means that all people get the right care in the right place and at the right time, wherever they are and whoever they are, and making sure they don't face any financial hardship as a result. The exciting news is that we're seeing unprecedented political momentum building for universal health coverage around the world. And as I said earlier, last week when the G20 leaders met, they also passed a communique, and I will quote, "We recall universal health coverage is a goal adopted in the 2030 agenda and recognize that strong health systems are important to effectively address health crises. We call on the UN to keep global health high on the political agenda, and we strive for cooperative action to strengthen health systems worldwide," end of quote. This is because more countries are seeing that universal health coverage is a smart investment. UHC plays the foundation for progress towards all the other health targets, including the one we are here to talk about today, beating non-communicable diseases. There are 2 sides to the non-communicable diseases challenge. Clearly, it's important to provide services to test and treat people who are ill. But the real breakthrough will come when we can stop people developing this disease in the first place, prevention being the foundation of what we do. As you all know, one of the single biggest cause of non-communicable diseases is tobacco. and tobacco kills more than 7 million people annually. That's equivalent to wiping out the entire population of Bulgaria or Paraguay every year, and that's unacceptable. But that number is beginning to fall. We are here today to celebrate the fact that 60% of the world's population is now protected by what WHO calls best practice measures to curb tobacco use, like banning advertising, outlawing smoking in public places, and taxing tobacco. This opens the door to saving tens of millions of lives. My colleague, Douglas Becher, will tell you more about this in a moment. What concerns me is how to protect the other 40%. So I'm delighted to have Michael Bloomberg at my side today, one of the world's most accomplished businessmen, former mayor of one of the most important cities in the world, melting pot of the world actually, and a committed and passionate advocate in the fight against NCDs, especially tobacco. Thank you so much for your service, commitment, and passion, Mike. And I'm excited to see so many heads of states also embracing the cause. I welcome the invitation from President Tabare Vázquez of Uruguay to co-host a ministerial conference on NCDs in Montevideo this October. I met him in Geneva a few weeks ago, and I really witnessed firsthand his passion and commitment, and a real champion in the fight against tobacco. And that's why I say his government and himself has been a trailblazer in the war on tobacco. That's what I call leadership, and join me in congratulating him and others, congratulating Mike Bloomberg and others, and who stand up with us all in the fight to beat NCDs. I thank you. Now I have the greatest pleasure and honor to invite WHO's Global Ambassador on NCDs, Mike Bloomberg, to give his remark. Mike.